Before we get started, I do want to say, if you're not familiar with beYogi, we offer all-inclusive yoga liability insurance, and we offer it to, in-studio yoga teachers, people that do online classes. So if you're interested, check us out at beyogi.com. Today's topic is about yoga safety, yoga precautions in the studio, and how you can provide that safe practice for everybody, regardless of health conditions, age, background, or ability. As you can all see, our expert is Anne Swanson. She is a certified yoga therapist and author of Science of Yoga, and we will include links to her website in the chat later on. Through her training, Anne discovered that the key to optimal health and living your best life lies in the mind-body connection, which I'm sure all of you are aware of. Now, using this connection, she helps people relieve pain and transform their health through yoga, mindfulness practices, and through teaching about the fascinating science of yoga. And thank you so much for joining today. And we're super excited for this workshop. So whenever you are ready, you can take it away.
Awesome. I'm just taking a look at the chat here, and we've got a lot of teachers from veteran teachers who've been teaching for 25 years. Welcome, Suzanne, to some newer teachers, and everybody seems really interested in preventing injury and being safe for their students, which is important. I want to start off by saying that I don't want this to be like a fear-based thing. I want it to be from your heart, a heart-based thing. So when we really think of why we're here, it's what I'm seeing in the chat. It's that we care. We care about keeping our students safe. We care about applying yogic philosophy to our teaching, which involves ahimsa. No harm to ourselves, teaching our students to have no harm to themselves, but also no harm as we guide them through a practice. So I'm just taking a look a little bit more. Linda says that she's read some of my articles in Yoga Journal, and she has the book Science of Yoga. So I did want to point out in my book Science of Yoga, I talk a lot about the benefits of yoga and ways to practice and embodied practice, but in the back here, a little known section, just very simple, very colorful book all around, but then in the back, this simple section is called Precautions. And this is organized by the different conditions themselves. So if you have a hip replacement or one of your students has a hip replacement, you can see some basic precautions for that, as well as like asthma, arthritis. So this is a general overview of those precautions, as well as just in general, what we need to do to be cautious of. And in the chat right now, Lizzie just added a link. Oh, that's to Science of Yoga. The /precautions. Yes, so she sent the link to the book. So click on that if you'd like to check out the book, order it afterwards, Amazon, wherever you buy books, Barnes and Nobles, your local bookstore, of course. And then also another resource I have for you in addition to the book is what Lizzie just added now. So that is AnneSwansonWellness.com/precautions. You can see that in the chat. This is a handout that I recommend you get. I'm just going to show it to you for a moment. Just want to start off getting all these little things through. So here, oh, we got the chat in the way. We've got this precautions handout that I made that guides you through the precautions organized in a different way. So the precautions in the book are by condition. This is by type of pose. So these are precautions for all poses. And then we take it into each type of pose: partial inversions, full inversions, back bends, rounding of the spine, forward folds, twists, core engagement, side bends, all these different categories, even hot yoga and intense breathing meditative practices. So we'll be going over some of these. I had a really great group of yoga therapists take a look at this and peer review it. So I'm really excited to share this with you. And when you go to that page, annswansonwellness.com/precautions, you can download this for free. And so I hope you can do that right now as you're joining. I'll remind you a little later when we start looking at it too, but then you'll get that to your email. And all you have to do is in your email, just go to the first email from me and say, confirm it, and you'll get that handout. You may even want to pull it up now. So I want to start by opening with any questions you may have. I'm going to scroll through a little bit here, but I think mostly what we have so far is you telling me who you are. Yoga teachers from beginning to veteran yoga teachers. I would love if you wrote down if you have any particular questions. It could be something broad about scope of practice or intake forms, or it could be something more specific, like, do you really have to keep your knee over your ankle in Warrior Two pose? So what is the most common injury? That is a good one. I'm definitely going to answer that one in a few moments. Keep the questions coming. I really want to tailor this to you all. Keep those questions coming. One thing that I did see as a pattern in here is a lot of you folks work with seniors, and I spent most of my career working with seniors. So when I was a kid, I loved older adults so much that I would spend my weekends going to the retirement community just to visit. My grandpa, who is turning 97 soon, is my closest person to me and on earth. So I've always had that connection. And when I became a yoga teacher in my early 20s, I knew I wanted to work with seniors, and I worked in retirement communities for many years. I worked in every single unit of the retirement community. So that means the independent living, where we would possibly even get on the floor for some yoga classes, assisted living and chair classes, stroke recovery, all mostly wheelchair classes, dementia, pre and early stage and advanced dementia units. And so that's what I did for the majority of my career as I became a yoga therapist also. So this was a topic very important to me. I didn't feel like in my basic training, we went over all of these precautions, and I really wanted to keep them safe. I also have some, let's see, what other questions do we have so far? Johanna says that she's a fairly new at being a yoga instructor, and I'm just open to getting as much information as possible. Oh, Regina asked a great question about standing forward folds, whether you should release your head, lock the knees, the cues on that. We will definitely go over that. I'm just making some notes. I think we got a few people that would like to know about standing forward folds. We'll talk about that from the lens of common conditions that may affect, like osteoporosis, herniated discs, and just back pain in general, which are very common in group classes, not just in seniors, but group classes in general. So I'll talk about that. Most common. I will talk about the most common injuries from a research perspective also. As you know, I teach on the science of yoga, so I dive into the research. Any recommended reading for working with dementia patients? You know, one interesting thing is when I first started, when I was like in my early 20s, starting as a teacher, and I got this job working with dementia patients, I looked into the research. What does the research say about yoga for dementia that could give me some clues? And every time I searched in PubMed, where you search the medical literature, I only found, for the most part at that time, there was only yoga for dementia caregivers, which is very interesting. It was just an area that it's very stressful, and they found that yoga was very helpful for them. So there is not a ton of research on it specifically. There's some emerging research. But I will talk about some safety for dementia and some tips on that, because I do have a few. But I don't have, I can't think of a recommended reading. We will have a follow-up email. If I think of some recommended reading for that, I will send that on your way too in the follow-up email. What is the safest way of falling down from a headstand when you're learning it? Okay, we're gonna just talk about the safety of headstands in general. So I'm going to put that on the list, and I'll mention that, but that's, I think, one of the smaller topics within the safety of headstands. Yeah, headstand injuries, that's what Lynn wants to know also, so I'm glad. Oh, following directions is a concern with dementia patients. And I would say also in just seniors, it's a little different in how you teach to keep them safe. So I'll talk a little bit about that. Any other questions that you definitely are dying for me to answer? How to manage a back bend and balance for people with Parkinson's. Awesome. I'm just interested in this room right now, who is a yoga therapist? Let me know if you're a yoga therapist or if you're in training to be a yoga therapist. I know I have beYogi insurance because they cover yoga therapists, and I'm a certified yoga therapist with IAYT. And so I'm just a little interested in that. I see a lot of therapeutic questions, so interested in that. Okay, difficulties hearing with the mixed class. We'll talk about that too. Some of it is cueing in a way that keeps everybody safe if people can't hear you or see you well. So these are really good questions. Melissa asked, some yoga instructors say don't round your back in poses and others say to round them. What are the do's and don'ts? We're going to talk about that with the standing forward fold. So I'll talk about rounding of spine. Okay, getting the most with stroke patients and limb imbalance. So I'll talk a little bit about safety with stroke because that is a big topic for preventing stroke, for preventing injuries, as well as I'll mention working with stroke, but that's getting a little therapeutic, right? So focusing on the safety aspect of that. Scope of practice issue. How do you deal with students who ask for help with specific physical issues that are not, and you are not a yoga therapist. And even if you are a yoga therapist, you don't diagnose, you don't treat the specific issue like a doctor or physical therapist would. So it is very different. So that is something, scope of practice, how to, oh, right. This gives me a great place to start from. Any tips for safety in chair yoga? I actually think a lot of the other things we cover will help with the safety in chair yoga because we'll be talking about how to communicate better, how to demo better a little bit from some of the things that have come up. So yes, I do have some tips on that. All right, where to start? Let's start with scope of practice. I think that that's something we need to first understand as a yoga teacher and a yoga therapist. So I'll talk to both scopes of practice. By the way, if you continue to have questions that you'd like to add to the list, please do just shoot them out. We'll keep an eye on the chat and try to get to as many of these questions as possible. And thank you so much, Lizzie, for helping me out here and organizing this. So send Lizzie some love.
Of course.
Okay, so scope of practice, and this question that we just got in is actually right to this topic. So I'll talk a little bit about this. So as a yoga teacher and even a yoga therapist, you do not diagnose anything. So even if you think it might be a herniated disc, or you think they might have arthritis, it's not your place. You are not qualified at all. They need to go to a doctor in order to get a diagnosis, or physical therapist, depending on what their condition is. So refer. Anytime you feel uncomfortable, anytime you don't know what the condition is, anytime you don't know, you refer, say, have you talked to your doctor about that? What does your physical therapist say about that? What movements does your physical or occupational therapist say you can and can't do with that injury, with that surgery, with that condition, right? Those are really good questions to ask because they may not know what they can and can't do with the hip replacement or the back surgery they got, and they may need to go ask, can I do forward folds? Should I avoid this? Should I avoid that? Or is it safe? So it really, I often will send them to their doctor or medical professionals to get that information for me. And a lot of times folks will know, they'll be proactive about their health and they'll know also. So refer anytime. That is your place, is to send people to their medical professionals. And when they come into the classroom, this is a big debated discussion. I have a question right here. How do you ask students about any injuries or health conditions coming into the class, especially if they didn't pre-register? So ideal situation. Your yoga studio or you who runs a small group class or one-on-one classes will get an intake with information about their health that is relevant. A lot of times we just don't have that. They drop right in, right? They drop into class and we didn't have that time beforehand to look it up, to ask them questions about it. So one thing not to do is raise your hand if you have any injuries and tell the class about your injuries and health conditions. Nobody wants to do that. So second backup plan would be to say, go up to people individually and say, is there any physical or health concerns that I should know about as your yoga teacher? Anything that would affect your yoga practice? Because I don't need to know about their full medical history, but I need to know, are they pregnant? I need to know, do they have arthritis or an injury in their wrist, and maybe they're going to need some extra modifications for their wrist, and I should keep an eye out for that. Have they had any major surgeries? So I usually phrase it, is there anything I need to know to help keep you safe? So it's not, tell me all your health conditions, right? So in that last moment, worst case scenario, I don't even get time to go up to them and say that. I'm not going to have them raise their hand and tell the class. Don't do that. That is private health information and people are not going to feel comfortable with that. But worst case scenario, I will say in the beginning of class, and I wish I could see you all right now, but do it in your space. Rub your hands together. Rub your hands together. Create some warmth, building that heat, that energy. Heat is energy. So we're creating friction. All right, now that you have this healing, warm energy, place it on any area of your body that's speaking to you, maybe an area you have an injury on, maybe an area that needs some love today, maybe massage it a little, maybe just hold it there. Then I can look around the room. Do they have their hands on their knees? Maybe I come up to them one-on-one. Are your knees okay? What's going on? So everybody's eyes are closed, by the way. So I get this opportunity to see and maybe to walk around one-on-one to talk to them. In a Zoom room, what do you do? I'm already anticipating that question. I ask them to private chat me anything. Private message me. I keep that message open in the corner so that I can see if there's anything. If you, right in the beginning of class, ask for any requests, feel free to unmute yourself. Feel free to write in the chat if that's more comfortable for you. But you can always private message me and show them how. Go to the chat on the bottom and let me know if you have any health conditions or injuries that I should know of that will help me keep you safe. Okay, let me just open that up to y'all because I know we have folks here that have a lot of expertise. Any questions and additional comments on that? Oh, I'm so glad you found that helpful. Great, awesome, Suzanne.
And I was actually, you brought it up about like a Zoom class, but I was gonna say, I think we needed to talk about, what if they all come into my Zoom class, how am I able to communicate with them? But you explained that perfectly. So I'm glad we went over in especially a very online type of setting.
Lizzie, I actually have a free guide on safely teaching Zoom. If you go to my website, AnnSwansonWellness.com, maybe Lizzie, you could find it while we're getting some of the comments here. And well, maybe I can find it easier. It's how to teach virtual yoga is what I think. Mm-hmm. And if you click on that, I think it'll lead you to where to get this free, and you can send it to a link. It's under Work With Me, Teach Virtual Yoga. And then you scroll down, you can find the link there. I have this great guide. It even has all the tech that I have. Join waitlist. That's not what I want. That's not what I want.
We'll find it. We'll definitely find
Okay.
it, and I'll either find it during this webinar or we will email it to everyone in that email.
Yes, it might be virtual-yoga. Try that out. Yeah, we'll send you that free guide that I made in the beginning of the pandemic. I saw this need because I have been fully virtual for years. When I became a yoga therapist, I said I want to be location independent and able to travel and live wherever I want. Here I am. I'm in Honolulu right now. Came here for a week, but I ended up staying so far 8 months. So I really wanted that freedom. And also I work with, my focus is arthritis and chronic pain. And when you have severe arthritis, a lot of times getting up and going to a studio, parking, all of that can be really difficult. So it worked well with the clientele that I work with. So I've been fully a remote Zoom for like 6 years now. And I had all these guides for my students, how to use Zoom. Now I don't need to do that. But I have a lot of resources, a ton of resources for you. Oh, virtual, did that work? That's the opt-in?
Yes.
Great. It's right there in the chat for you. So I recommend to download that. And you'll get all the tech that I use, a bunch of tips that I have on teaching virtual yoga safely. Yes. Oh, I've been petrified of teaching in front of the camera. Yes, it can be. One tip that I have, keep the class small. Limit it to 5 people. Especially, I mean, it's going to be easier to see them all on the screen. I think that's one place, especially if you're petrified, keep it small. Yeah. We think, oh, you need to have a big class, but on Zoom, it's hard to have a big class. So, and the bigger the classes, the simpler you have to keep it. And it's just keep the class really small. Okay, I have, Suzanne says, sometimes in my class, I ask if there's any requests. This helps because they may say shoulders, because my shoulders, yeah, they may address the issues. I have a wrist issue, oh, that's my request. So I think that's a great way to do it too. I'll often ask for requests, pretty much every class, I'd say. I guess that's what we're doing now. All right, yeah. So we talked a little bit about scope of practice. We talked a little bit about how to ask for the injuries or do an intake. Ideally, you have a full intake. I will say there is a school of thought that says don't get the information, because the more you know, the more liable you are. And there are many lawyers that will tell you that. I fully want to live the yogic philosophy of ahimsa. And for me to truly be the best teacher and hold myself responsible, and give the best class to my students, knowing helps me keep them safer. So I've made that decision to know, and I believe that's how we practice ahimsa best. So I ask, I want to know as much as I can. And okay, so just wanted to make that point. But also we have a release form, which Lizzie was telling me earlier that beYogi has a sample release form that you can use, and you can adapt and work with your own lawyer to adapt it. Lizzie, do you have any information about that?
Yeah, we can definitely send that out in our post-webinar email, and that'll come from Lizzie. And the one thing about it is we definitely want to make sure that if you use this template, that's awesome, but definitely get some information from a lawyer, a legal expert, someone that can look at your practice, look at your teaching style, and exactly determine how you want to do that. But we do have a template for you all.
Awesome. Yes, thank you. So having that release form, as well as, obviously your insurance, is a good safety thing. Okay. Let's talk a little bit about working with older adults, because I think a lot of you are in that boat. And you know what? I think if you're not in that boat, you should get on that boat, because the number of people in that older age range, 55 plus, and then 75 plus, 90 plus, like my grandpa, that are craving yoga, that could benefit from yoga, is rising. And the popularity and acceptability of it has also been rising. So there is a demand, and there's less teachers that do it. So, and in addition to that, it's more rewarding. I started doing it in my early 20s, and it was so rewarding versus the studio classes for me. I've made really true connections, but also it does pay better. So win-win in all different aspects. You can get paid more and then afford more and better training so you can improve your skills and serve them better. And it's just, it's been a beautiful career for me to work with older adults. So some of the questions we got is about if they can't hear you very well. So I will say that when I teach older adults, I am louder and clearer, not to the point of being slow, like, hello, how are you doing? But definitely I pronunciate, I'm moving my lips a little bit more dramatically in that class sort of setting. I'm also very aware for Zoom that I either have a mic, that could just be your headphones, your wireless headphones could be your mic, right on me. So I have some, like, you can use your AirPods, whatever, they have a mic on them. Because then when you turn your head, the sound continues. Or if I'm not having that, when I turn my head, I get even louder because I know that the voice is projecting this way. So I'm very conscious of that, and that's a skill you develop. But I do recommend headphones if you can. That Zoom guide that I put, that we're sending to you in the follow-up email, has some suggestions for headphones. And then I demo with them. I know in my basic teacher training, they taught a lot, you should stand and watch and not move with them. But it's a little different when you're in a retirement community, especially if you're working with dementia. It's a little bit of they see and they do. They're copying you and moving with you. And since the movements are so simple, it's actually quite safe for you to move with them, right? And that's one of the things I love about, I would teach 28 classes a week. And I know that sounds absurd to some of you all, but a lot of them were 30-minute classes where we're doing joint freeing movements. So I didn't get exhausted. I was able to have a really sustainable career teaching in that capacity. So you really demo with them a lot of the time, a lot more than a regular studio class. I mean, it's to the point that if I start fixing my hair and fixing my ponytail, they all put their hand back here and fix their ponytail, even if they don't have hair to fix their ponytail. So it's very much like that. So demos, in addition to speaking, taking it slowly. There's the class you plan, the class you teach, and the class you could have taught, should have taught, right? It's always being adaptive. You plan a class, but usually I teach 50% of what I plan. So being adaptive with that and going a little slower can be really helpful with teaching older adults. Another thing is setting up the classroom, and in person, I would often do a circle with the dementia students, especially, because then they felt as part of a group. They didn't have their back to anybody. They could see everybody. They could see me. They could see that we're all moving together. It makes lefts and rights a little difficult, but I just don't care about lefts and rights. Lift one hand and move it. Lift the other hand. Lift the hand near the window and move it. Let's all lift the hand near the window. Let's all lift the hand near the wall. Those cues are easier than lefts and rights. Some people like to mirror, and some people like to do lefts and rights, and they'll actually flip it in their head with you and they can't mirror. It's like I'd say about 20% of them will flip it in their head, and mirroring is too much for them. So being adaptive to that and not like strict, it has to be, we're all lifting our left hand, is really helpful, especially with older adults, where it just can get confusing for them. I'd like anybody that has suggestions or questions specifically with working with older adults and keeping them safe, go ahead and put that in the chat. I'd like to talk a little bit more about that.
Someone did, so Suzanne sent to us, she said, I've taught older adults too. This is why I stopped playing music during class. Interferes with their ability to hear clearly, and then also just like in general, might just confuse.
Yeah, that can be something to consider. Another thing to consider though is if you do go in a retirement community, sometimes there's no walls. So it may not be a quiet environment. So I was like in a cafeteria space and there's people yelling and doing their thing on the other side. So I had to use music to create a space in that little corner, that I was cultivating this space. So it wasn't an ideal situation, but being very aware of where you put the music, I put it usually more behind me, not on the other side of the class, because I don't want to compete with it. I want to be aware of how loud it is and make sure I'm louder if I do use music. Yeah. Orienting toward the window, toward the wall. I like that. Yeah. So some concerns with working with older adults is osteoporosis and osteopenia. Osteopenia is the softening of the bones, and osteoporosis is when they get really brittle to the point that they're likely to break. So when folks have osteoporosis, it's really important to strengthen and to move. But it's also important to focus on preventing falls, which is something we really want to do in those older adult classes, holding onto chairs, holding onto the wall. You really want to find stability and focus on preventing falls for everybody, but especially with osteoporosis. And it's important to focus on not doing those rounded forward folds, which we're going to talk about in a moment with osteoporosis. So rounding your spine forward, if there's osteoporosis of the spine, can cause microfractures of the vertebrae themselves, or even a larger fracture. Also twisting too far. Any movement really too far. You want to keep it within your comfortable range of motion. But when you combine, especially a movement like twisting and a forward fold, like how people do, definitely a twisted triangle. But if you just do a regular triangle, for a lot of people, that involves rounding of the spine. I know it's not ideal, but that's what ends up happening. And a little twisting. That is a higher risk pose. So any pose that combines both rounding of the spine and twisting is going to be higher risk. So something to keep in mind. Usual length of class for a dementia and for seniors. For seniors, I would do 45 minutes to an hour and 15, depending. And then for dementia, I would do 30 to 45. And I think of some of the classes a little bit of the before and after, gathering them. I would go and gather everybody, make sure they safely got to class if they're living in home sort of situation. And I'd set them in the circle, and I'd prevent any fights between Mary Lou and Edith that are happening. And one way is to have a little bit, actually, speaking of music, before the class begins, some old-timey music, because with dementia, your brain can still process singing even when you can't speak. So some of them will sing along. It'll really bring them back. And I often will have a balloon, just pop that balloon around and just create a nice, aware, focused environment. Just they sit in the circle and they pop the balloon around. Just a little tip. Yeah. Going against the wall for triangle is a really great way to prevent rounding and stability, preventing falls. So I really love that. Back against the wall, you have to have a lot of wall space. So whenever you have that wall space, I say use it. I teach full wall classes when I have wall space like that. Yes, I'm so glad you like the balloon with the music. So great things we're getting in here about seniors. One thing I'm just going to do is share my screen to the Yoga Precautions handout. And Lizzie, for anybody that's coming in, could you put that link in the chat once again to get the /precautions? Recommend downloading this. And if you even want to go to your email real quick and make sure that you've clicked confirm so that you get that precautions handout right to you, that would be really great to take care of that. So in the beginning of this precautions handout, I have some really great research linked for you actually about the benefits of yoga for these major conditions, as well as some research showing the safety of yoga, which, by the way, the research shows that yoga is as safe, if not safer, than other forms of exercise. Because we have that mindfulness aspect to it, it is assumed that it's probably safer. But these are going to all apply for working with seniors, but they're also all going to apply for any class that you have. And I just got a question in the chat. Can we share this amazing resource with our classes? You sure can. As long as you've signed up and gotten it from the /precautions, you have the rights to distribute. I will, as I update this, because I do continue to update it based off of your amazing feedback, based off of having other professionals look at it, based off of the research. I will be sending you an updated version since I have your email once you've filled that out. And so you'll get that updated version. By the way, if all of this is super interesting to you, when you are signing up for it, ask, are you interested in the Science of Yoga course, which is opening up soon. You can check that box. You'll be the first to know about that because that is opening up very soon. And we go over a lot of the safety and the science so much more in depth. Yes, please print this, share it, email it to them, share it. Absolutely. And if you know another teacher that wants it and wants to share it, they just need to put their email in there so that I can make sure they have the most updated version. All right, so first rule with a hemza is no harm, right? Is don't do anything that hurts. I have a caveat in there, or increases pain. Remember that I work with chronic pain. So a lot of people come into the room with arthritis and they're already at a level 7 in pain. So they're like, don't do anything that hurts, just sitting here hurts. That can be very frustrating to somebody in pain. So I'll often say, or increases the existing level of pain that you have now. So that is something I'm always going to emphasize in the beginning of every class. Every single class I'm going to mention, you are the world's leading expert in your body. Do not do anything that hurts you, that you feel uncomfortable with. You get to choose. And I like to give people the option to visualize a movement, not just have to do everything. If you want to sit for a moment and visualize doing a movement that's not comfortable for you, your brain is actually going to fire neurons and fire to that arm muscle as if you're doing it. And your brain sometimes, if you're good at visualizing, doesn't even know the difference. This is why Olympic athletes do this in order to prep. They close their eyes and visualize doing their flips, doing their routine, doing the course. And research has shown that this actually works. You actually will get stronger. You actually will get more flexible. Pretty crazy. So focusing on giving options to rest. You don't have to do everything. I am your guide. You are the world's leading expert in your own body. So don't do anything that feels uncomfortable. Avoid movements. This is an important one that are sharp, shooting, sharp sensation around the joint. What you want to feel is vibrating sensations in the belly of the muscle. I'll show on my arm here. Like the belly is the center here. I don't know if you can see me too. Belly is the center of the muscle. If you grab, you feel the meaty part. You don't want to feel any sharpness or pain or pulling around the joint. So that's something I like to just emphasize when we get into a pose, like a good hamstring stretch. You know, you don't want to feel this at your knee. If you do, either ease off of it or slightly bend your knee. That's allowed. All right, so we don't want to have any numbness or tingling or sensations down the limb. When you start feeling that, stop. If they don't know what it is from, don't tell them. Tell them to go to their doctor and figure it out. They need to get imagery to know. So no numbness or tingling. Don't practice yoga under the influence of alcohol. I see the wine in yoga, and that's totally cool to have wine after yoga, but not wine before yoga, or I see them balancing a glass of wine on their head, not during yoga, right? That's a huge liability for you as a teacher. You would never want to do that. Also, drugs such as pain relievers can be alter their state of being able to feel whether they've gone too far in a pose. So even something as simple as Advil, I tell people to take it down a notch because you just can't feel that you've gone too far. Some people are on pain medications. I wouldn't have them come into my class on a Vicodin, but they may be on a pain medication all the time. And in those situations too, take it down a notch. So those are the big no's right there. And then we have some precautions, the yellow right here. Thank you, Joy. And so we want to avoid fast movements, jerky movements. In a yoga class, we can move slowly and mindfully in and out of poses. That's going to be precautious. It's under precautions because there may be some fast movements depending on your class. So you just want to be really careful of them. and who your audience is. Remember, this next one is very important. Remember that we all have differently shaped bodies and bones, and that not every pose is appropriate for every person. So this is an important fact, I think, that really emphasizing in more and more yoga teacher trainings is that our bones are shaped differently. I talk about this on page 52 of Science of Yoga. You could see the head of the femur. It could be at all these different angles, which would affect a pose like Baddha Konasana, whether your knees are up in the air or they go down flat. Some of us might be able to stretch the inner thigh muscles and work to bring our legs to go down flat. But some of us, the only way we would go down flat is if somebody jumped on our legs and then it chipped at the bones enough to be able to get it down there, which is not what we're going to do, obviously. In addition to the shape of the femur, we also have the shape of the pelvis and where the hole in the pelvis is, or if it's male or female, the female is more broad and the male is more narrow. This is why males tend to be less flexible in their hips, the shape of their bones of their pelvis. So we don't want to get to the point where we're saying, oh, you can look like this picture in the book, or you can do the pose like me, when that person's body may not be built for that pose. And just accept that we are all different. Or you are different. You may be able to, you may teach a pose that your body doesn't quite go into in the same way as another student. That's okay. And that's something to be really celebrated, that we are all different in different shapes. Yeah. Okay. Let me just share my screen again. Let me go through the rest of these and I'll show you how to use this precautions handout. Okay. So dizziness and vertigo, which is actually just kind of what Suzanne said about people can get nauseous in forward folds. That's another thing. Nauseousness, dizziness, vertigo, forward folds will do that. And then something to be aware of, one reason why we do ask for medications is not because I need a whole list of your medications, you to pull out that list. It's more, the question I'm really trying to get at is, are you on any medications that cause dizziness, nausea, a disability to feel your body? Is it going to affect your practice? Is it mind altering? So there's side effects to medications. A big side effect is increasing the risk of falls. So that's just something I'm looking at. If they're on 5 or more medications, research has shown that their risk of falls has increased significantly. So when I see a long list of medications, I'm like, all right, fall risk right there. I'm going to watch them. So the things you want to do is follow your doctor's orders. And if you have any concerns, ask your doctor. As a teacher, we're going to refer them out to their doctor. Do warm-up movements in the beginning of class. Warming up your joints, get the synovial fluid. This is going to help flowing. This is going to help prevent injuries. So taking that time to really warm up. Avoid falls. So I've already mentioned that we want to be very precautious of that. And then after surgery, they probably don't want to go to yoga class right after surgery. But you know, if somebody comes to me after a surgery with one-on-one class, I may shift it to meditation. We're going to do a healing meditation. So just ask your doctor what is okay to do after surgery. Any questions or comments on that? I see Sarah says she feels tingling in easy pose, just cross-legged pose. I say modify it so you don't feel the tingling. That is common to feel it after a few minutes. Don't worry, that's very common. Sit up on a bolster. Switch your leg positions, put a bolster between your thighs and do more of a Vajrasana, modified Vajrasana. That one feels a lot better for me. I think that modifying it with props is going to be really helpful for you, or sit in a chair. If you start feeling it too much, get up and sit in a chair. Totally fine. All right. Yeah, modify with blankets, towels, a rolled up towel. I use, because of Zoom, right? And I've been doing the Zoom thing for a while. I say grab pillows. Bed pillows are great. You can kind of roll them, turn them into a bolster. Also, the cushions from couches are your best friends. Those are pillows, big cushions of couch pillows. Also, those long, skinny ones. Those are your bolsters. You could also grab a sleeping bag, that's all stuffed up in its sleeping bag container. You could even stuff some blankets in there, or stuff blankets in a pillowcase. Make your own homemade bolster in the shape that you want to do. Yeah, couch pillows are, I love that. The couch potato yogi. I use the couch all the time. Put your legs up on the couch. You put your legs up on a chair, put your legs up on the bed, whatever you got in your view of the Zoom, put your legs up on it. So constantly using things around, instead of a strap, we use a dog leash or a jump rope or a belt to a robe. So you don't need to buy a lot of props. You can use what you have around the house. I love that. Thank you. I'm going to look back at my list because we had so many great questions in the beginning. So we talked a little bit about working with older adults. One thing I'd like to talk about is the most common injuries. I'll actually pull up some of the research here. I have it for you. So is yoga safe? What can the research tell us about it? So let's see. We have several studies. This study, the Safety of Yoga Systematic Review. This study has a pretty cool conclusion because it shows that yoga is as safe as, if not safer, than other forms of exercise. So that's really what doctors need to know, what people need to know, to know that with health conditions, you can do yoga. The findings of this meta-analysis suggest that the frequency and severity of adverse events, that means the injuries that happen, associated with yoga are comparable with other exercise or usual care, getting up and walking to the car to get to the doctor's office, usual care. However, yogis, let's see, what do I want to say from this? It's generally a safe intervention, but you should have a qualified teacher. I know that's one of the things that they said. This was a summary that Time Magazine said, yoga is as safe as other exercise. That's really the final point we need to know. This study shows 76 cases, and it has 9 people, or 9 people of them partially recovered from their injury, 1 no recovery, 1 fatality. Let me tell you about this fatality. A teenage girl was in the hallway at a dance, and a teenage boy said, I can show you this yoga breathing exercise. She was on drugs. I don't know what drug. She was on some psychoactive drug, and she ended up having an air embolism from it. So that's not exactly what you're going to be doing. Don't worry, you're not going to be teaching people on drugs in the hallway of a dance. So that's that 1 fatality, and that I would say was not yoga. He was not a yoga teacher. But what the poses with the most injuries were headstand, shoulder stand, lotus pose, which is actually to the point that we just got about legs falling asleep in an easy pose. Lotus pose is when you cross the leg up on top. And so that will cause the neuropathy, the falling asleep, sciatica, fractures if you force yourself into it, especially at a young age. And then forceful breathing practices. Most injuries were musculoskeletal, sprains, strains, tears, that sort of thing. Nervous system injuries, and then eye-related. That has to do with these inversions. When we go upside down, if you have glaucoma or the precursors for glaucoma, that can make that worse. So that's mainly the eye conditions. Any eye condition that involves pressure like glaucoma would be affected, which this is all in that precautions handout. So these are the most common conditions or poses with injuries. Some other ones, a bow pose, I've seen a lot in the research with injuries, because you're like on your belly, you're reaching back, you're trying to grab your leg, you twist. So we're combining a back bend with a twist, and we're kind of grabbing. So I don't really teach bow pose that much. For that reason, I see people struggling to get into it. Those are some of the most common injuries. But we've gotten several questions about headstand. So I do want to talk about how to stay safe with headstand and some options for headstand. So going upside down, actually, I'm going to show the inversions part of the handout rather than this. Going upside down has its own precautions. And you can scroll down to partial inversions, like a back bend here, or forward fold, and full inversions. So everything in the partial inversion section is also a precaution for full inversion. So let's start there. So with glaucoma, recent cataract surgery, retinopathy, with issues that involve pressure in the eye, you're going to have to talk to your ophthalmologist. So I would avoid these sort of poses where you go upside down. You can modify though. Put your hands on your shins and keep your head above your heart. Lift your head up in downward dog, or put your hands on a chair and keep your head up. It's the head going below the heart aspect, the building of pressure, that is the concern. Blood pressure issues. If you have really high blood pressure and it's poorly regulated, that's where you're going to have issues going in inversions, whether it's partial or full. People that have low blood pressure and tendency toward vertigo actually will have that issue too. So whether it's high or low, those could be concerns you want to be cautious of. Being dizzy, if they have high blood pressure and they go upside down, they may turn red or white. These are things you want to avoid. You don't want to see this. So we have cautiousness of dizziness, high blood pressure, any changes of color of the skin. That's what you're looking out for. Any changes in the breath. Are they holding their breath? Are they panting? And then some heart conditions you can't go upside down on, but they would know that ideally if they have any of these heart conditions. Avoid a full inversion if you have an ear infection. I have osteoporosis and osteopenia because of the risk of fall in that full inversion, as well as a lot of these poses put weight on the neck and spine in a way that could cause injury. Pregnancy, I say don't learn, if you're pregnant, don't learn a new inversion, and maybe don't do inversions. I have some friends that are very comfortable with their body and they did inversions their whole pregnancy. They would be here in this scorpion pose with a big belly. And she's done it for so many years. That's her choice because she has that proprioception. She knows how to get out of it to fall properly, right? But I wouldn't ever teach it or recommend it. All right, it is you actually can perform inversions. I think that there's no medical reason that you can't, as far as we know. This is what many doctors I've talked to have said. This is the literature does not confirm what I think a lot of teachers say, is that you shouldn't go upside down when you're menstruating because it can cause some issues. However, one thing is in yoga, we have a concept of a downward energy, and just energetically, it might feel better to not go upside down when you're on your inversions. When you're on your period. So I maybe just do my legs up the wall if that's more comfortable for you, but there's no medical reason not to. And with headstand, there's an additional concern with the neck. Well, with all of these poses, actually, with the neck, there's an artery right here, the vertebral artery. And what can happen anytime you put pressure on the neck, or even poses where you lift your head up. I'm going to do it a little bit. I always imagine there's an egg behind my neck and I don't want to squish it. If I were to, and I'm actually not going to do it fully, if I were to drop my head back, as a lot of people do in poses, it's a really high risk thing, and not just for older adults, for younger women too, who have been on birth control. It increases your risk factor of stroke. And we have seen in the medical literature, young women in their 30s, 40s would be the most common age. People that have been on birth control for many years, people that are higher risk of stroke, on some sort of blood thinner perhaps, or anybody, but those increase the risks. Having a stroke from a yoga class. We've also seen that age group have strokes from going to the beauty parlor and dropping their head back in the sink, from other exercise classes, definitely from gymnastics. So I am very cautious with inversions, as well as any pose that drops your head back. What can happen to that vertebral artery is it can slightly tear, and then a little bit of that tear creates a clot, and the clot can be released into the brain. So that is a risk that I just would like to avoid. So that's why I'm very cautious with the neck and not throwing the head back, not moving it drastically. If you're at a high risk, not going into any pose that puts pressure on the neck. I just want to open up to the chats because that was a lot. A block under your head. For what pose would you use a block under your head, Lynn, to help with safety? You passed out, Suzanne, putting your head too far back. Yes, that can be what happens. You put pressure on these arteries, cut off the blood flow. Yeah. And when I taught in retirement communities, I went and did a sample class and I had them do all these neck movements, right? Because we're doing chair yoga. And I was a young teacher, I was moving the head all around. And a woman came up to me. She said, I have a PhD in voice, I don't know what the word is, laryngology. I'm not sure if anybody knows, throw it in the chat. She's like, I have a PhD in this, and what you're doing, especially with the older adults, could cause a stroke. You need to be very cautious with those number of neck movements. And so since then, some of the cues I say when we lift our head, like in a cobra pose, or even just the back bend, hands on the hips like this. Everybody try it. Put your hands on your hips, lift your chin slightly, and look only up as far as where the ceiling meets the wall ahead of you. And imagine there's an egg behind your neck. You want to keep a gentle curve to your neck. You don't want to drop it back. You don't want there to be a fold there. And if you're doing a back bend, it's just the neck is an extension of the rest of the spine. This is as far back as you need to go, which means I don't do big circles, right? I may do the lower half of the circle like this, but I don't swing my head around to the circles, especially not in the retirement community, for that risk factor. Laryngologist. Same with camel, and I actually speak about that. This is what comes up in the book in Camel Pose, is this exact thing. Is I'm not going to find it quick enough, but in Camel Pose, I don't want you to drop your head back, and I explain that. There it is. So I talk about in Camel Pose, dropping the head back and how that can affect the vertebral artery. And an option instead is to keep the neck nice and neutral. Don't drop it back. Funny story, they wanted this pose to be on the cover of the book. Well, even funnier story, they wanted, let me share my screen. They wanted, initially, this was the cover of the book when I started the book contract. And I said, I will not write a book with that cover. Not about the science of yoga. There is not a single yoga researcher that is putting that pose in the research. The research is on helping people with arthritis, Parkinson's, all the concerns you're mentioning now. They're looking, is this safe? What can we do to improve safety? Is this effective for people with multiple sclerosis? The research is not on poses like this. So I said I didn't want that pose, and that is one of the poses that is a stroke risk, the way the neck is and falling. So they wanted then Camel Pose, and when I sent them the model, so often I'd get into the pose and I would model it and I'd send it to them, and they're like, no, we want the head drop back like this. It looks more dance-like. I said, no, this is the reason why not. We can't have that on the cover, and we compromised and got this cover, which I think is good because you can modify this pose. You can do it seated in the chair with the strap. It's a good modified pose.
All right.
Yeah,
and you're on
our limit, huh? I think I did everything except standing forward folds.
We have 2 minutes. Yeah. Yes. We have a couple minutes. Yeah.
I think that's the biggest topic, is standing forward folds. Do you round your spine or not? And also seated forward folds. Your spine, your body is meant to move in all these directions. How it moves, like cat-cow, is your body is meant to do that. However, cat-cow is horizontal, and the forces of gravity are not putting the same pressure on your spine. So even cat-cow or lying on your back, hugging your knees into your chest, that rounds your spine, right? Child's pose rounds your spine. Your orientation to gravity is not putting the force of gravity on the vertebrae, on the discs. When we do a standing forward fold and we round our spine, now we have the force of gravity on us. We have the weight of our body pulling on it. And now we have the risk factors. So I just want to start off by saying it's not the rounding that's the issue. Our body is resilient and meant to round, and you should round in your class. But when it's like Paschimottanasana, seated forward fold, now you have all these pressures on. on your joints, on your joint structures. So your vertebrae, if you have osteoporosis or osteopenia, the concern is the fractures. But if you're younger in the 30-40 range, 20s, 30s, 40s, the concern tends to be more disc issues, herniated discs, bulging discs, and the rounding forward of the spine pushes the disc out and can cause a herniated disc or exacerbate one that's on its way. So generally speaking, the larger class I have, the more people I have in the class, if it's Zoom, then I don't see you, I'm not teaching rounded forward folds. I just don't want to go there because there's those risk factors. I'm not saying you can't, and you and your body, you know your body, if you don't have these risk factors, you can do a rounded forward fold. But it's just a riskier movement. So some modifications are putting your hands on your shins and keeping your spine straight, or on blocks, keeping your spine straight, as straight as possible. Even if you are doing a rounding, I say, keep it as straight as possible, hinge, hinge, hinge before you round, whatever pose it is. Keep that length before you go into a round. Same with a twist, length, 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 then twist. Same with a back bend and back bend. So always focus on length to protect your joints, your spine, your discs, because coming off of the spine are all these little nerves that can get pinched, as well as I mentioned, the bone itself, the vertebrae, and the discs in between. Rolling up to standing is something I don't teach either. And I'm not saying you can never do that. Actually, I have a video of this on my YouTube channel. Maybe we should send them a link to my YouTube channel too, if you want to subscribe to that, because I put out a video every week with practices that are safe. Lizzie, it's on the bottom of my website. If you click that link that has a little YouTube link, then you'll get that link. You can copy and paste. That's the direct link to it. You can put it in there. Yeah.
Awesome. So, and I'll definitely include that in our email.
Oh, stroke patients. I would often, when I'm teaching, I would either have them visualize the other arm lifting, actually lift the arm, put a strap between the arms, lift both. So now they're moving together. Visualization is really key with that population, because it still sends the neurons fire and go to that area.
Awesome.
A restorative forward fold is going to be safer. Yes, just wanted to answer Kathleen. That's safer.
Awesome. Well, this was amazing, and I know there's so much more we could go and talk about for hours. But we did have an hour limit for Anne because she's so busy. But this was an amazing thing. We will include all of those links in our email that you will get tomorrow, including the full webinar replay. So you will be able to watch it and to send it to whoever you think would love it. Thank you so much, Anne. This was a pleasure to have you. And I'm so glad we were able to have all of these attendees watch it live and see you as the expert you are in this field. So thank you so much for joining us today.
Yeah, and if you have any other questions, feel free to ask a question on my YouTube videos. I always answer those. Feel free to go to Instagram and ask questions there.
Yeah, we'll include exactly how to get in contact with you, Instagram, your YouTube, contact form even, but yeah, all that information will be included on that blog that we'll post, and then also the email. But thank you so much for joining, everyone. We'll see you next time.
Bye-bye.
All right. Bye-bye.